Yeah, very good afternoon. We start. See, last class I spoke to you about two or three very small remedies. If you remember, we spoke of digitalis, apocynon, and calcareous. Okay. So, do you have any quick questions to ask? I assume you have gone through the notes or you have referred some books. Any questions? Any doubts? Okay. So you're all set for a new topic. Chalo. So if there are no questions, then let me straight away start with a new topic. So this is again a very interesting topic for homeopathic student and of course for the homeopathic practitioners. See, if you look back when homeopathy was introduced, you know, there were a lot of new concepts that came in. And homeopathy was in a very infant stage, or it was in a very initial stage, and a lot of people were trying to contribute. Few contributions were worth and few it spoiled the image of homeopathy. We are looking at one such concept today. Okay, now before I start talking a little more in detail about this particular topic. See, when we start looking around, for example, I know must be if you start looking around, you are in your room, you are in your house. See, must be if you start coming out and if you start looking, we have people, and we have different people, not people, we have different people with different emotions. Few of them might be very happy, jolly, and few of them might be very, angry, and few might be melancholic, few might be sad, few might be mischievous. I mean, we are all different individuals. This is what even Dr. Hahnemann very clearly states about individualization. We are all different individuals. We are all different individuals with different emotions, with different likings. You might like coffee, I might hate coffee. Fine. Okay. With different likings and different aversions. Okay. Somebody likes very something which is sour, and they thought that somebody is eating sour might bring some kind of a disgust in you. Okay. So we are all different individuals. So individuals emotionally, mentally, even physically, we are different. Some might be short, some might be fat, some might be tall, some might be obese. Yes, we are all, some might be dark, some might be fair. We are all different individuals. Okay. So, any wild guess, what am I trying to focus or what am I trying to, share today? Any wild guess, post lunch session? Okay, what is it that I'm trying to discuss today? See, I'm trying to tell you about different individuals with different emotions, fine, and different likings, different physical appearance. What is it that I'm trying to share today? What is it that I'm trying to share? What is the topic that we are going to discuss today? So, okay, somebody says individualization. Okay, fine. It's a material class. Very good. Pujita puts a question mark. Sir, are you talking about constitution? Very good. So I'll remove the question mark. So it's absolutely right. We are going to discuss about constitution. Now, what do you know about constitution? I mean, to start, as a third year student, what exactly you know about constitution? Hmm? So constitution is what? It could be, okay. So what is constitution? I mean, what is it? Very good. Ayman says it is physical and mental makeup. Beautiful. Yeah, Padmini also agrees with Ayman. Okay, Shivraj. Yeah, majority of you are coming up with the same answer. Okay. So moving further, we'll just see how this word constitution came up. Okay. And what exactly is the meaning of the word constitution? See, if you look, majority of the words, they have either come from Latin or they have come from Greek. Okay. So this word is come from Latin constituere, which means constitute, to set up, to establish, to form, as somebody rightly said, make up, to appoint, to give, to begin to. These are all the different meanings of that single word constitution. So, as rightly said by many of you, this is a very important definition that you should be aware. Constitution. So this is something we use in our material teaching very often. We use in homeopathic practice very often. Now, what is this constitution? What is this made up of? Is again very important and interesting. So, constitution, as told by a few of your friends, it is the physical and mental makeup. I am going a step ahead. These are all things taken from the source books. I'll tell you in the end which books I referred. So, constitution is defined as physical and mental makeup, which is revealed through his physical build, through his characteristic desires, aversions, and reactions, as well as emotional and intellectual attributes. See how beautifully it is told. So it includes the physical makeup. That's what I just told you. How is a person's physical build? Is he thin? Is he tall? Is he short? Is he fat? How is he? That is his physical appearance. And mental makeup. Okay. So is he angry? Is he emotional? Fine. Is he sad, revengeful, hatred? It could be a lot of things. And the characteristic desires and aversions. All these things put together will will give us the exact thing what constitution stands for. Okay. Now Hippocrates was the person who first spoke of a constitution. Going ahead, there are a lot of theories. If you look into the books, if you look into the internet, when you type constitution, a lot of articles pop up. There are a lot of theories. I'll not go into all those theories because we have 40 minutes time and I need to complete a topic. So Chinese, Hippocrates, Ayurveda has its own way of understanding constitution, has its own way of defining constitution, and they have their own types of constitution. You can read all these things, but as a homeopath, what you need to understand is, one second, let me unlock. So, as a homeopath, what you need to understand, or what is that uh, constitutional concept that we homeopaths follow, is also very important. He is one Dr. Von Grogol. Okay, a line or two about him. He was a German homeopath. Okay, and he contributes or he writes a book about biochemic constitutions, and his classification is what we as homeopaths agree, and we sincerely follow his definition and his classification of constitution. So whatever I am trying to tell the next few minutes is what is based or what according to von Grogol's constitution is what I'm going to describe. Okay, so try to understand. We'll try to go step by step. It's a very simple topic. I'll also tell you the key points in the end, or we can have a small revision and we'll try to conclude in the end. Okay, so though Chinese, Hippocrates, Ayurveda, and other Unani and other systems, they have their own way of understanding constitution. We follow von Grogol's classification of constitution. Okay. See now, I was reading a small book. The Constitutional Medicine. There's a small book in our library. This is by John H. Clark. So it's a very small book. I was reading this book, and Dr. Clark says Grogol was a very good chemist, and he had a very sound knowledge about chemistry. So and he classifies constitutions in a very systematic way. So see now what is there in the air and what is there in our body. So based on that, he classifies. Fine. The excess or deficiencies of certain elements in our tissue and in our blood, he says, can bring in some variation. So according to him, he classifies the entire constitution into three important varieties. I'll just name, and must be next few slides we'll try to understand what those constitutions are. So any idea what are the constitutions according to Grogol? Out of interest you would have studied, or your materia or organ teacher. Very good. Sana comes up with hydrogenoid. Good. Yes, Roshin is talking of carbonitrogenoid. Yes. And one more is oxygenoid. Good. So there are three types. Very good. Keep it up. There are three types according to Grogol. This is what we call it as Grogol's constitution. So the first important thing is what we already know about this particular constitution, and this is Hydrogenoid Constitution. I have a very detailed text which will be coming up a little later, but what you need to understand from the word Hydrogenoid Constitution. See here, there will be excess of water. Okay, so these people, they are very very sensitive to the atmosphere which has more of water content in them. So we'll slowly try to unfold which weather there will be more of moisture, which fruit, which vegetable, all those things. But what I am trying to emphasize here is this will become very very important. Now that Bangalore, you have a very beautiful weather. See, I say beautiful because I'm a different constitution. But if you are a hydrogenoid constitution person, then this is a weather that you will be hating, because this weather will bring in lot of complaints, or lot of complaints that you already have, you will have an aggravation. So few of you might like rain, you might go out, play in rain, and hydrogenoid constitution person is somebody who will not enjoy rain. Okay, so yeah, I mean, see, tomorrow in our practice we might be seeing patients coming to us. As a practitioner, I have observed they come to us telling, "Sir, I don't like this weather. I'll get cold. I'll get wheezing. I'll get cough." Fine. So a set of patients who are very sensitive to cold air or that moisture, and then they suffer with some diseases, or the diseases that they are already suffering. If those diseases they get aggravated, they all come under hydrogenoid constitution. So what you need to understand is This is the text, but ultimately it means the same, that they'll have more of water, and they're very, very sensitive to water. Okay. And wherever there is water, fine, that atmosphere or that surrounding will cause an aggravation to them. Like if you just concentrate on this part here that I've tried to mention, again taken from Clark, that small book on Clark. So here he says mineral bath, eating animals which have lived in water. For example, he says people after eating fish, or people who live in damp weather, or people who eat vegetables which has more of moisture. Okay, they all suffer. Yes, good, cucumber, fish, yes, melon, watermelon, so they all suffer with illness. Okay, so I hope you are clear. Now we'll try to quickly understand which are, one second, yeah, so which are those which weather is characterized by excess of moisture. So which is the weather? Can I have some quick inputs? Yeah, Sai and Shivraj has spoken about a remedy. Okay. Yeah, we'll go step by step. I'll be talking to about remedies also. Good. So now, rainy season, yes, wet weather. Okay, rainy, wet weather, where you have more of dampness. Okay, so these weather that I've tried to mention, they will have excess of moisture. And tomorrow, you see in your clinic, you have patients coming up with complaints during these seasons. Okay, so they belong to hydrogenoid constitution. See, if you look at miasms, I don't know how much of miasms are over for you, but I know as a homeopathic student, you know that Dr. Honeyman classifies miasms basically into three: sora, psychotic, and syphilitic. Now, this accumulation of fluid, okay, this hydrogenoid constitution corresponds to Dr. Honeyman's psychotic miasm. Now, this is what you third year students need to understand. Hydrogenoid constitution is equal to Honeyman's psychotic miasm. Now, this is important. Now, going ahead, now this is what Sai has already told. Like, which is that food which is characterized by excess of moisture? He spoke of, what, cucumber, melon, watermelon, any other food, any other vegetables or any other food, veg, non-veg, that you can think of, which will have excess of moisture. Good seafood, like fish, prawns, good, keep it up. Okay, very good. This is what Padmini's text, and this is the image, and probably juices, like orange or musambi. So they again have a good amount of moisture, good amount of water content. Melon, Sai has already spoken of. Mushrooms, they also have good amount of fluid. Okay, so these are all the food which is characterized by excess of moisture, and majority of the times a person with hydrogenoid constitution will have an aggravation after taking all these things. See, whatever theory you are learning should have an implication or should get reflected in practice. Okay, so this is how tomorrow in your clinic you'll be seeing patients coming, and they say, sir, machi khane se ya cucumber, watermelon, mushroom, my complaints get aggravated. You can think of any of or they belong to hydrogenoid constitution. People living near riverbed, sea areas, okay, seashore, fine. See, not everybody who are living near water bodies will belong to hydrogenoid constitution. I'm not trying to tell you that, but there are some set of people who are sensitive to that moisture, and only they belong to hydrogenoid constitution. See, you love cucumber, you eat cucumber. You love fish, you eat fish. Nothing happens. You don't belong to hydrogenoid constitution. Okay. I hope there is a clarity. Tomorrow some patient comes and says, "Sir, कहाँ पे रहते हो आप? Sir, my house is near that river, that pond." Then don't you know uh, blindly take it that he belongs to hydrogenoid constitution. He might be comfortable living near the river, living near the sea or pond. Okay, so they will not belong to hydrogenoid constitution. If he has to belong to hydrogenoid constitution, then his cells, his body will be sensitive to the moisture, and they will come up with some symptoms. Hope I am clear. Okay. Don't misinterpret the images. So, what are the salient features of hydrogenoid constitution? Once I finish hydrogenoid constitution, we'll have a quick revision, and only if you are clear, we'll take up the next constitution. So, the person under this constitution, I told you they are generally obese and they're very slow people. Mentally, they're very slow, very lethargic, okay, uh, very lazy. For this man, see, even taking the dog for a walk, he's using his car, right? Thanks to Google Images, from where I've taken the images so that you students can get a better picture. And this picture, naturally, if you see an image, it will remain for a longer time. And mentally, they're very lazy, very indolent, fine, very slow, very sluggish. Okay, these are few keywords you need to remember. And the salient features, uh, they are worse in cold, damp weather and in the rain. The present Bangalore weather. These things we have just discussed. Milk, cucumber, mushroom. These things can increase their complaints. Slow intake of nutrition. Shivraj has spoken of accumulation. This is the right point here. There will be more retention of water in the tissue. You'll be seeing that they'll have more of edema. Very good. They'll have more of edema. Yes, Sai has given you a detailed picture. Absolutely fine. They will have tendency for water retention. Okay. And there is a good amount of periodicity. Now, what is periodicity? Symptoms coming up in a pattern. In a pattern. Fine. So, like for example, once in a month, once in 7 days, same day. डॉक्टर साहब अभी देखो 12 बज रहा है मेरे को अभी खांसी शुरू हो जाएगा clock like periodicity. I will discuss in final year. The remedy is citron. Will not focus on that part now, but periodicity means something which is coming in a pattern, weekly, daily, hourly. There will be a pattern. Okay, there will be a specific period. Mentally, we saw that they are the people who look so weak and as if there is no life. Okay, they are very slow, they are lazy, they are indolent, and there is no life. These are all the aggravating factors. Okay, and you already mentioned that it's a very good. What you also see here is edema, anasarca. Clinical conditions where or what are those clinical conditions the hydrogenoid constitution suffers from? It could be asthma, it could be joint affections, or it could be obesity and many more disease conditions. Okay. So now, I wanted to ask you this particular question. From your remedies list that you already know, which are the remedies that will come under hydrogenoid constitution? See, the list might be very few for you. Good, Tuja, Dalcamera, antimonium crudum, antim tart, yes, good. One very important remedy. The moment we say, yeah, could be Restox, I don't know. Yeah, who's that? Roshini, Natrum Sulf. Natrum Sulf is one top remedy that should come to your mind. Good. Anyway, the other contributions are also absolutely right. Good. Now I will give you few that has been mentioned in your repertory. This I have taken from complete repertory. Sorry, Murphy. I have taken it from Murphy. And if you see the list that you have contributed, you have given all the remedies. Okay. Must be a missed Arania. That's not there in your syllabus right now. Arnica, Calcarea, Causticum, Nitrimure, nitric acid are few more remedies that you have missed. But minus that, Antimproved, Tart, Restox, Thuja, Netromself, Dalcamara, Medorinum, you have given all the list of remedies. Okay, good job. Fine, we'll go ahead. Now, before I take up the next constitution, any questions or any clarification you want in Hydrogenoid Constitution? See, to sum up, we were talking about, we defined constitution from which word the constitution came up, what exactly it meant by the word constitution, okay? And different people had their own way of classifying constitution, but it was Dr. Gragol, a German homeopath, who classifies it into hydrogenoid, oxygenoid, and carbonitrogenoid constitution. Hydro Hydrogenoid is what we discussed in detail. Okay. So what is the character? Fine. What type of food aggravates? Who are the people who belong to hydrogenoid constitution? How are they mentally? What probable diseases they might get? And what are all the probable remedies? Any questions? Any questions? Any clarifications? If all of you are clear, then we'll take up the next constitution. And the next constitution will be Oxygenoid Constitution. Unfortunately, the animation has not happened properly here, but anyway, Oxygenoid Constitution. Okay. Now, here, what is happening in Oxygenoid Constitution, as the word tells you, there is excess of oxygen. Please mind the words that I am highlighting here. There is excess of oxygen, and this excess of oxygen will break down hydrocarbons, nitrogenoids, and albuminous tissues and bones, and they will give rise to destruction. Shivraj used the word accumulation when we spoke of hydrogenoid constitution. And I have been insisting in many of the classes, whenever the word accumulation comes up, the miasm is psychosis. Now here in oxygenoid constitution, what is happening? There is excess of oxygen. There is excess of oxygen, and this in turn is giving rise to destruction of tissues. From your simple knowledge of organon, this belongs to which miasm? Very good. Syphilitic miasm. Good. I'm happy you got it right. So this constitution, or the people who belong to this constitution, will have traits of syphilitic miasm. Okay. Now when I said hydrogenoid will be obese, now naturally oxygenoid will be thin, and they would have lost weight in spite of eating well. Appetite is good, they eat well in spite of eating well. Because of the destructive process, what is happening is they will not put on weight. Okay, they have prominent glands, big bones, and anemia is again part of oxygenoid constitution. Destructive pathology, disorders involving the genitalia and diseases of the central nervous system, they come under oxygenoid constitution. Okay, they like fat and they have an aversion to carbohydrate. These are all few traits of oxygenoid constitution. So it is equal to Dr. Honeyman's syphilitic miasm. And hydrogenoid constitution is equal to which miasm? Hydrogenoid constitution. Yes, good. It is equal to psychotic miasm. Good. Now oxygenoid constitution is equal to syphilitic miasm. Okay. Now, now, what are the salient features? Okay, this we already saw there. They are thin, but they eat very well. In spite of eating well, they are not gaining weight. Hydrogenoid, you saw that they were very sluggish, slow. Here it is exactly opposite. There is increased physical and mental activity. Okay, and bad effects of change of weather. See, one second. Here in one book they refuse fatty food and animal food. So this I feel will ignore that. They generally like more of fatty food. So that part you please ignore. And disease wise, they are more prone to ulcers. If you are looking at the bodily part, they are more prone to ulcers. Ulcers and self-destruction. Self-destruction means they want to commit suicide, they want to end their life. Yesterday, there was a very nice case. I will share the case in detail after the patient improves. But what was the thought process in him? He had bad eczema over the tip of fingers. I've been treating him for past 4 to 5 months with on and off results. With one remedy, he feels better, and after 15 days, again he comes back with a bang. And some 3 4 medicines have changed with absolutely no improvement. And he is in a very bad state. Yesterday, I was trying to tell me, sir, it's better I die. I many times feel no, it's a very simple problem, eczema of tips. But if you look at his story, he's not able to wear his dress, he's not able to eat, he's not able to unbutton his shirt because tips are very, very important for all those moments. And he's so fed up. Naturally, he's taken treatment from me for quite some time. He's not better, and I am asking him not to apply ointment. So he is sincerely following me, not applying ointment, at the same time, not getting results the way I am expecting and the way he is expecting. So yesterday I was telling, sir, it's better I end my life. What is the use of me living like this? Now this is what I am trying to tell you. He's gone into a self-destructive mode. Okay. So oxygenoid constitution, they go more into self-destruction. The bones are weak and naturally the glands are prominent. Okay. And I've also taken this from a small book, Dr. Mukherjee. I have this book right now here. Constitution and Temperaments by Dr. R.K. Mukherjee. Few points taken from that book also. He says white spots on nails are all part and parcel of oxygenoid constitution. What are the simple clinical conditions that comes up in oxygenoid constitution? It's a destructive miasm. It's a destructive pathology that you're going to see here. So naturally, deeper diseases, ulcers, tuberculosis, destructive diseases, yes, destruction of bones, osteomyelitis, good, etc., etc., can come under this. And miasm is syphilitic. Okay, hydrogenoid is more psychotic. Oxygenoid is more syphilitic. In oxygenoid constitution, there will be excess of oxygen. Okay. Yeah. Now, one second. See, this is again the remedies here. They have been misplaced here. Please don't go by this. Anyway, luckily I've taken it from the repertory. This is carbonitrogenoid constitution. We'll be talking it later. Now here, One second. See, now this is what the remedies you need to remember. You have more of iodine here. Okay. I don't know if iodine is over for you, but if you have already understood iodine and if it is over, you know iodine fits into that picture. They eat more, increase hunger, but they'll not gain weight. Prominent glands, good. Okay. So these are a few characters of oxygenoid constitution. Arsenicum iode, ferrum iode, iode and kali iode are few remedies. The list we can add. Now that see, it was way back. Now that we know more about these constitutions, the list we can increase. So I'll get back to the last constitution. Now here this image, what I'm trying to tell you is, he is eating well. They're two different individuals, don't worry. But what I'm trying to tell you here is, though they eat well, they are not gaining weight. That's what is very important. So we'll come back to the last constitution. And here, this are the people who belong to this particular constitution, carbo-nitrogenoid constitution, will have excess of carbon and nitrogen, but there will be deficiency of oxygen. Okay, and majority of the complaints that you see in these people are caused because of nutritional issues. Okay, they suffer from functional disorders of body and mind. See, so beautifully Gragol says they suffer from functional disorders, and according to Hahnemann, functional disorders belongs to which miasm? Yeah, very good. Before the question is asked, Sai, the answer is Sora. Good. Yeah, many of you have got it right. But Sai got it first. Good, keep it up. So the miasm is Sora. The function, the structure is fine. There is variation in the biochemistry. The function gets disturbed. Hmm? So carbo-nitrogenide constitution will have excess of carbon and nitrogen and less of oxygen. And there will be, because of less of oxygen, the oxygenation gets affected, and it will cause retardation in the nutrition, and then the function of body and mind gets disturbed. Okay, the heart, the lungs, the kidneys, the liver, the spleen, all major organs, okay, that balance, that functioning, the working pattern, that gets disturbed. Okay, so people who are obese, they go into uh, weakness, or they start losing weight, and then they become lean and thin. So they belong to carbo-nitrogenide constitution. This is equal to Dr. Hahnemann's soric miasm. Okay. Now, what are all the diseases they suffer from? Who? The people who belong to carbo-nitrogenide constitution. What are all the diseases they suffer from? They generally suffer from epistaxis, more of skin, eczema. Again, see, palpitations. They're all very functional. Short breath, lungs are not functioning properly. Short breath, heart, that physiology is getting affected. So there might be palpitation. Even mentally, you see these people are more anxious, they're very impatient, they're irritable, and they're restless. So this is how mentally they are. Now the remedies we just saw here, it was misplaced. Under carbo-nitrogenate constitution, you have more of sulfur coming up. Argentum, cuprum, aurum, aurum murum, netoratum, cuprum aceticum. These are few remedies given in the repertory. Fine. But we have 5,000 plus remedies. Look into the salient features and we can keep adding. That's not a big deal. Hmm? So before we close, it's almost 40 minutes now, solid 40 minutes we have spent. Hope you got an idea. Now, before I close, what is also important here is Why the concept of constitution? Why is the knowledge of constitution important? This is again the vital part. See, the knowledge of constitution from drug proving, they play a very important role. Though the remedy is given to different people, only those constitutions who are sensitive to that remedy, they will come out with maximum symptoms. They will come out with maximum PQRS symptoms. Okay, so constitution plays a very important role in the drug proving and also in the occurrence of natural diseases. Tomorrow, if you want to cure a patient, the knowledge of constitution, the knowledge of constitutional medicine will play a very important role. Dr. Honeyman speaks about constitution in aphorism number 5. Yeah, to understand the person, to understand the disease, your approach, you should know the constitutional, you should have the constitutional or constitution knowledge. It's very important. Okay. Tomorrow to match, you know what sulfur constitution is, how sulfur looks physically, you know what phosphorus constitution is, you know how anti-crude mentals are, how do they look. Okay, so these are all the constitutions which are very very important in our day-to-day practice. Okay, so having a thorough knowledge will make homeopathic practice more easy and more simpler. Okay, so I hope yeah, we don't have time. Next class I'll be talking to you about diathesis. Diathesis, and if time permits, I'll also try to talk about temperaments. Okay, so students, out of interest, please go through diathesis, go through temperament so that we can have a better interaction. Okay, now did you get the concept or did you understand the constitution part? Definition, different classifications, and again Von Grogol's classification, hydrogenoid, carbonitrogenoid, and oxygenoid. Oxygenoid is which miasm? Oxygenoid corresponds to which miasm? Very good, syphilis. And carbonitrogenoid corresponds to which miasm? Good, Sorik. And the only one that we have left is with psychotic, and the psychotic miasm is nothing but hydrogenoid constitution. Very good. Okay. So salient features, what diseases they are prone to, all those things are so beautifully explained. Okay. Sora, psychosyphilis. Fine. So I hope the class was clear, and I hope you have understood the concept. Any quick questions? If at all you have any questions, all of you are clear with the explanation. Okay, if you're clear, good. Thank you for joining, and next Tuesday I'll talk to you about diathesis and temperament. This is a 3-mark question, or if you're lucky, it can come for 5 marks. Define constitution can be a 3-mark question. Define constitution, list the type and its character can be a 5-mark question. Okay, so either of the one is sure shot to come up in your exams. Chalo, thank you.